And for a conversation on the directive of the House of Representatives on mandatory hepatitis vaccination for children under 5 and the call for investigation into the disease spread across the country, we're now joined by Dr. Nseabasi Ekanem, National Coordinator Civil Society Network on Viral Hepatitis in Nigeria. Doctor, good to have you with us today.
Good afternoon. Thanks for having me.
Very good. So, how significant is this directive from the House of Representatives on mandatory hepatitis vaccination testing and treatment for children?
Yeah, first of all, many thanks to Honorable Kwamoti for raising this motion and to Honorable Benjamin Kalu for actually ensuring that this was adopted. Yes, viral hepatitis is a very significant challenge to Nigeria. And its mortality and spread has gone to an alarming rate in the country. And just like the Honorable said, as we speak now, over at least 20 million Nigerians are living with the disease. And unfortunately, just unfortunately, over 80% of those who are living with this disease are not aware of their status. So that is why it is very important that Nigerian government put in place measures to ensure that those who are infected know their status and they can take informed actions to be able to get treated, and those who are not infected can also access vaccination. So for us, for the House of Rep, this is a very important decision that has been made, and it's important that all ministries, departments, and agencies rally around to ensure that the decision made by the House is followed to the letter. And of course, I know that the House Committee on Healthcare Services would definitely swing into action to carry out more investigation. And that means that we need to mirror the kind of research or survey that was done in 2018, what we call the Nigerian AIDS Indicator and Impact Survey, so that we can know the national burden of the disease. And this will help us to design strategies towards nipping this disease in the bud by ensuring that the basic services that are necessary are provided to people living with the disease, not just children, not just children under the age of 5, but all those who are infected with hepatitis B virus. Because if we don't do that, then the spread will continue to increase, and that will put the life of so many millions of Nigerians at risk because of this virus.
Very good, Doctor. As you said, 20 million Nigerians affected. That prevalence rate is quite high. So is there enough public awareness on hepatitis over time? And what will it take to enlighten Nigerians, you think?
Yeah, I really must say that the awareness has been very low. In fact, in 2018, what the WHO, that is the World Health Organization, advised the Nigerian government to do is to be able to mirror what is happening with HIV. I mean, so many years, about 20 years ago, HIV was also suffering from this lack of awareness. And as a result of that, there was high stigmatization and discrimination. Today, so much has been done in HIV in terms of creating awareness, in terms of engaging the communities, in terms of even engaging stakeholders that are involved in HIV services. Unfortunately for hepatitis, this is not so. A lot of people living with hepatitis, I can make bold to say that over 80% of those living with hepatitis do not even know that they have the disease. In fact, most people who get to know their status only know their status when they go maybe for a blood donation, or probably when they go for medical examination, for job interview, or for marriage. So it is important that awareness is raised so that people will know about hepatitis. And raising awareness will also ensure that we clear or we debunk some of the misconception out there. Because if you go to the internet, you see a lot of misconception about how the virus can be transmitted. And because these misconceptions are not true, they fuel stigmatization. Some people say it is transmitted through sweat, through casual kissing or hugging. And these are some of the things that make people to stigmatize those living with this disease. But it is not so. Hepatitis B is only transmitted through contact with bodily fluids, while hepatitis C is through contact with contaminated blood. And of course, when the hepatitis B vaccine is given to people, then it reduces their risk of having the virus. So if we create this awareness and ensure that all Nigerians are aware of what the pathology of hepatitis, then we'll be able to ensure that the right information is there, and people will, this will in turn reduce stigmatization and discrimination across the country. That way, people living with hepatitis can access care, can access treatment without the fear of stigmatization.
Very good, Dr. Ekanem. Now, let's talk about the efficacy of vaccination itself. Is it a once-in-a-lifetime scenario, or it has to be a continuous effort?
Okay, so for hepatitis vaccine, we call it the insurance policy against viral hepatitis, but for hepatitis B. Because though we have hepatitis B and hepatitis C, hepatitis B is vaccine preventable. And if you give a vaccine, hepatitis B vaccine, you protect or you reduce the chances of such an individual from contracting the virus. Unfortunately, hepatitis C doesn't have a vaccine, but it has a cure. So for hepatitis B, which actually is the highest burden in Nigeria, because if you look at the numbers, we have about 8.1% of Nigerians living with hepatitis B and just about 1.1% living with hepatitis C. So hepatitis B really is a problem. And vaccination gives a lifelong immunity to the virus, and which is why we emphasize birth dose vaccination. Birth dose vaccination meaning that every infant must be given birth dose vaccination within 24 hours of birth. Unfortunately, I must say that in many of our healthcare facilities, both in the public and the private facilities, vaccination is not given at birth dose. So you see cases where hospitals, clinics, maternity homes, and other institutions, healthcare institutions, schedule vaccination date. So if a child is born on a Friday and vaccination day is Thursday, that means that that child will have to wait till Thursday. That 1 week is enough for the child to contract hepatitis B, which is why we are saying all hepatitis B vaccine must be available at maternity ward, so that as soon as the child is born, the vaccine is given, and that gives a lifelong immunity against the virus. That way, we can reduce mother-to-child transmission, which accounts for 90% of the cases of hepatitis transmission in Nigeria.
Indeed, Doctor, just before we let you go, briefly, what challenges do you face on advocacy on hepatitis as a group?
Okay, thank you. The major challenge that we have is funding, sincerely speaking. For both whether from the community level or at the state level or the federal level, what is lacking is funding. Unlike HIV that has global fund, global fund for international agency to support its campaign or its awareness creation, hepatitis does not have, which is why we are calling on the federal government of Nigeria to support both the public and the community structure to ensure that awareness is created as regards viral hepatitis. We need to engage the National Orientation Agency. We need to engage the Federal Ministry of Information. We need to engage other media channels like TV stations such as Arise TV to always send out information about hepatitis so that people can know the right information about hepatitis. If the government is able to put in that fund to support awareness creation, I can assure you that a lot of Nigerians will be informed and they will know the right step to take towards ensuring that they address, that they protect themselves and their families against hepatitis. But let me add this. Another thing is access to treatment. That is one of the main bane in hepatitis elimination in Nigeria. Most hepatitis patients, do not have access to treatment. Even when they have access to treatment, it is too expensive. That is why we are calling on the government to be able to access what we call the global access pricing, the global negotiation, so that we can have hepatitis medication as low as $2.4. If we have that, a lot of our patients will be able to access treatment, and those who are on treatment will be able to stay on treatment until they get finally treated. That's our recommendation from the Civil Society Network on hepatitis.
On that note, Dr. Nseabasi, Ekanem, National Coordinator, Civil Society Network on Viral Hepatitis, we'd like to thank you very much for your thoughts on this issue. It's good to have you with us.